Okay, I think we should get going. Thank you very much for joining us, everyone. And I hope you've been enjoying the day so far. Today we've got a really interesting session with colleagues from the Care Quality Commission who have very kindly agreed to speak to us about the work that they do. The CQC is the independent regulator of health and adult social care in England. And Colin and Fran, who you can see on screen right now waving, are going to talk to you a little bit about the work that they do and hopefully answer any questions you have, and also talk to you a little bit about the work that Carers UK are doing together with themselves to make sure that people are aware of care services in that area. So Colin, Fran, I will pass over to you. I'll be monitoring the chat box, everyone, so if you have got any questions, please feel free to put them in there and we can pick them up as we go along. And I think Colin and Fran have got a few slides to share with you at first. So thank you very much, and I'll hand over to you guys.
Colin, you're on mute. Great start, great start.
Thanks, Fran. That's because I had a little cough to clear my throat. I thought I'd better go on mute so that I don't deafen people. Thanks, Fran. Anyway, so hello, and thanks for saying hello by telling me I'm on mute. Our brief was to just give you a little introduction, but mostly be able to see what questions you've got so that we don't spend lots of time talking at you about things we decided in advance and not really having time to answer your questions. So we'll just go through a couple of little background, very introductory things. Some of that you may know, some you may not, and then we've got time for any of your questions. Just to warn you that Fran and I are not inspectors. We don't inspect services for CQC. We work with wonderful charities like Carers UK to help the organisation and their members understand what CQC is doing and to try and get the brilliant expertise of Carers UK into CQC's work to recognise that expertise. But having said that, even if we were inspectors, we'd be specialised to one of the types of service that CQC regulates, for example, care homes, and may not necessarily have all the details for a question about GP surgery, for example. So run the slides, Fran. Let's go.
No problem. And just while I'm off mute, hello everyone. Realised I didn't say hello before. I work in Colin's team, but he's just done a very apt summary of what our team does, so I will not repeat that. The slides should be working their way through.
Brilliant, thank you.
Yeah.
So, what is the Care Quality Commission? What do we do? As John said, we're the independent regulator of health and social care in England. Two bits to check on that. One is, as John said, it's adult social care. There are a couple of little bits and pieces we do with Ofsted for children's services, but generally we're adult social care. And I don't know where you're from joining us today, but we only look at services in England. Other bits of the UK have similar-ish public bodies that regulate services in their patch, for example, in Scotland and Wales. Our core role is to make sure that these health and care services provide people with safe, effective, compassionate, high quality care, and we encourage services to improve. Now, how do we do this? Any type of service looking at providing health and care in England must legally register with CQC for them to operate legally. So we initially have a registration process where they have to set out sort of how they will operate, how they will meet basic standards. And this is when we often need to help people who are perhaps entering the market, for example, setting up a care home for the first time, see whether they need to be regulated. You probably know some of the stuff we regulate. So I'd guess lots of you know we regulate care homes and hospitals. CQC also regulates a range of other services. So I mentioned GP services a minute ago. We also regulate private hospitals, but also lots of other things as well. So we regulate online GPs, regulate ambulance services, and a whole range of specialist hospitals such as mental health services and gender change clinics. In short, if someone is providing direct social care or medical clinical health services, we regulate them. We don't regulate services like opticians, for example, but a huge range of other services we do. We monitor, inspect, and rate those services. I'll talk a little bit about those in a moment. And when services aren't very good, we take action to protect people. In many cases, that will be providing the guidance and support and working with other services to get those providers to improve. In serious cases, it will be legal enforcement action against the service, which at its most severe would have the service closed down. And we also, aside from our stuff where we report on individual services, you know, what's the standard of the care home up the road from you, up the road from your parents' house, we also produce reports that look at issues across health and care. And that's with what is called our independent voice, which sounds very grand, but it means work that we do that is supposed to be independent of government and independent of people providing services. It's supposed to be an independent view on what's happening. You'll see later this month in the news some work that we're publishing our main annual review of the state of health and care services in England. That will be out later this month. You'll see that on the news. So I say those big independent voice reports are separate from the reports we do around individual services and the ratings we produce on independent services. But those reports and ratings for services are the end of a process, really. It starts with two things. One, the service registering with us, but also CQC hearing from people who use services like you, and to a degree also people who work in services. Now, hearing people's experiences, their feedback on the care they've received is vital to what CQC does. It informs our decisions on what to inspect and when and where. And our inspections are risk-based at the moment, so it'll be focused on what feedback we're getting and the type of service. You know, will affect the likelihood of it being inspected. So your feedback's really important, and that's why we try to make it really easy for people to do that. On every single page on our website, there is a button at the top of the page where you can click to feedback on care. So you can see it on there. That's our website homepage you're looking at there. And in the middle, just underneath our letters, every page, you can see the button feedback on care. That's on every single page of our website. That will take you to a little page that will help you confirm which service you're looking at. You know, the big hospital in your town, the care home near your parents' home, so that you can make sure you leave feedback on the right service. We redeveloped that service just before the pandemic, and worked with an awful lot of individuals to test it, and with our partners like Carers UK. So we hope it's really easy and explains what your options are and what we're looking for each step of the way. So if you've got feedback on care you or someone you care for is receiving, do feedback. We also look at we also take positive feedback, because it can just help contextualize some other information. Should we move on, Fang, please? Thank you. So that feedback helps us to understand the quality of care people are getting. And like I say, that's really important because we use it from other data we're getting, for example, from people who work there, or information from the provider itself. There's things they legally have to report to us, changes in what they do, they legally have to tell us about. We put all that together and it informs what action we take. It informs whether we might change their rating, for example, under a system we're moving to. And because it helps understand what's going wrong when services are good, when the managers are motivated to learn from it, the feedback itself helps services improve. A key bit to point out just before we finish this bit is the CQC's legal role isn't doing individual complaint handling. It's not what the powers we're given allow us to do, but what we do is aggregate this feedback to drive what we do in terms of issuing ratings and reports, and like I say, in serious situations, taking legal enforcement action. If you do have a formal complaint, an issue, you should take it up with the service itself. And then otherwise, there are some other bodies, for example, the Parliamentary and Health Service Ombudsman, the local government ombudsman, perhaps, depending if you're getting care with the support of the local authority. And there's information on that on our website and on the Carers UK website. Should we go one next? So I say we do we work on a number of projects with Carers UK because of the brilliant work they do and the brilliant network of experiences and information and expertise from the carers that they work with. But one of the things we do all year round is that we work together to get more people's feedback on experiences of care. So Carers UK works with us to encourage carers to provide feedback on services they've used and perhaps concerns about their loved one, to help enable you to get that feedback into CQC's system. There's alongside that information on how to do that on CQC website or on Carers UK website. Actually, the Carers UK website has information about CQC and also, I believe, unless it's changed recently, John, information on complaints and dealing with local authorities and that sort of thing. So unless John or Frank think I missed something we said we'd talk about, that's covered the introductory stuff. I said I didn't want to spend ages talking through something we'd decided in advance to talk at you about. Wanted to leave lots of time for your questions, but we can come back to any of these slides if you want to ask any questions about any of them.
I don't think you covered, sorry, I think you covered everything, Colin. I can't see the chat because I'm sharing my screen, so if people are happy for me to stop sharing temporarily, I can pull them up at any time, if that's okay. So I'll just stop now.
Thank you very much, Colin. That's really helpful run through, and I think now you're both very happy to take questions from participants. I've got a couple that I might ask myself as well, if that's okay. But I first wanted just to point out that Kausar in the chat had said that, well, Kausar, I don't know if you want to come off mute and talk yourself about what you put in the chat about the work that you were doing in Leeds alongside CQC. Sorry, oh, there you go.
I'm a volunteer for Leeds City Council, and we do work alongside the Quality Care Commission, going into people with disabilities homes to see if it's a good place to... Did somebody ask something?
Sorry, I think someone was just muting themselves. Please keep going.
Yeah.
Kath.
Yeah. Over COVID, obviously, we couldn't do our visits, but before that, we actually designed the way we were going to inspect ourselves with Inclusion North, who helped to facilitate it. And there's quite a few carers and also people with learning disabilities that are part of the group that we go to different homes and stuff. But I think it's amazing to be able to be in a privileged position like that, to be able to go in and see, I mean, when we inspect, it's not if it's a dirty place or if it's a clean place, it's more about the sort of things that the people that live there do. So they're always active and out and about. So that's what is priority to us. And this all came about from Winterbourne problems that we had. We all felt as carers that something needed to be done. So we got together and put this together, and it's still a very active document that we forever, after we've been to visit, we come back with our questions and we put them back to the organisations, the providers, and they always give us feedback, and then they make those changes. So they're really impressed with some of the questions we ask, and they do listen to us and change those. And also for the volunteering we've done, we've received a kite mark for the work that we've put together. So we're really pleased with the work we've done in Leeds, and people, the organisations are asking us to come and visit them and come and assess their places. So yeah, I just wanted to let people know that, there is some super work that's going on. Yeah. So if anyone's got any question, please do ask.
Thank you.
I just say, I think congratulations on getting the kite mark for that work. I know they don't hand those out easily to everybody. I'm just looking at one of your questions there about does CQC look at the lack of services? So one of the things I spoke about CQC does is produce sort of these reports looking at issues that are going on across the country, as well as our reports about individual services. And I mentioned one we've got coming out later this month. One of the things that we're going to be highlighting in that report later this month is the huge level of unmet need, and how there are a few issues driving that, but also how it has consequences. For example, people being discharged from hospital because they can't be, because there's nowhere to go. But in terms of having the direct power to do something about it, we don't. We have the authority to speak up about things that we see that are going on and problems they might find. But in terms of power to then directly address that, for example, direct Leeds City Council commissions more beds, we don't have the power to do that. Whatever budget Leeds City Council may or may not have, we don't have the power to do that. But we can highlight that it's a problem, and you can expect to see us doing that again later this month.
Well, yeah, that's what I was expecting, because I mean, if you don't have that conversation, if you don't talk about it, nothing gets done. So for me, it was more about raising, and then for all of us to, in our own capacities, to do as much as we can, because disability nurses, specialist nurses, there is a big need. So yeah, please do what you can. Thank you.
Thank you very much. That's really great. Colin, I'm going to come to Matthew's question next, and then I'm going to come to Hazel, take another couple in the chat, and then I can see Catherine and Paul also have their hands up. So Matthew's question, Colin, was, does the CQC have a carers lead for the organisation?
Sorry, John, did you want me to do these questions individually, or were you going to do them?
Yeah. Sorry. You take them one by one, and then I'll come to the next one.
Right, okay. Yeah. In terms of like the short answer is it tends to be based on the work with carers is threaded through a lot of what we do. So we've got our senior staff focused on different types of services, for example, adult social care and care homes, learning disability, mental health, primary care, and in how we look at all those services, and therefore the work those senior leaders need to take account of, there is looking, the role of carers is included in all of that. And we've just been having meetings with Emily Holzhausen and John about how, when CQC changes its model in the coming months, how we can do that even better. But I will say as well that we do internally, because we try to be good at this and we try to practice what we preach. We are an employers for carers organisation and have a very active carers support group for CQC staff that does get senior level backing and support. But all our senior leaders should be aware of this in their work. For example, in primary care, let's leave adult social care apart for a minute. In primary care, they'll know of the access challenges that carers can face.
And I just wanted to also add to that, Colin, that you have in your state of care report, that's your annual report, you had a dedicated section on the impact on carers last year. And I know your new report is coming out shortly for this year as well, isn't it?
It is, and that's the one I was referring to a minute ago. That will be out soon. And yeah, there's lots about carers in there again, and
Super.
about access.
Super, thank you, Matthew. Hazel, I can see you've got your hand up.
Hello, yeah, I'm a retired emergency department nurse and a carer for my son. And on both stands, professionally and personally, I've had to raise safeguarding concerns to the CQC, and I'm afraid they weren't very receptive. And unfortunately, we had to go to Panorama and uncover the really abuse of patients that we're seeing since I started at Winterbourne. I'm just wondering what's going on. Why aren't we picking these up? And, you know, I'm worried about the government is going to try and deregulate things. And I'm a bit worried, to be fair.
Yeah, I'm really sorry to hear that. Occasionally we look at whether we could have done something better. I mean, occasionally when some of these things come up, we look at whether we could have done something better. For example, the service that was in Panorama recently, which is perhaps it's unlikely to be the one you are referring to, but it was a secure mental health hospital. You know, we have been back into inspect that, and that inspection report will be out shortly. After the Walton Hall, the mental health assessment treatment unit was on Panorama just before the pandemic, because there were signs that we had been in there. Could we have
there was.
We done different, and then we did
move away from reports though, because there's a lot of them. It's why are we dehumanising, othering, and why are we normalising this sort of model of care? We've got to move away from producing reports. It's actually got to stop this. And part of Hillsborough's law, where we're trying to get a public accountability bill where the duty of candour can be strengthened, because people should be criminally prosecuted for some of the decisions that are made at board level around models of care for patients. It's not the way we want to go, but unfortunately, if we don't start moving up the ante, we're still going to have these scandals.
Yeah. And when you talk about these models of care, are you thinking of some of these sort of very closed environments? Some of these are sort of assessment and treatment units where people can end up for a long time and far from home?
Definitely these. It's even happening in our acute hospitals, people dying of constipation, malnutrition. As an A&E nurse, I'm absolutely shocked at what these things go on. It's a double moral injury for me as a nurse and a mum, that my colleague can do things to patients like this across the country, and it's got to stop. Yeah,
I mean, we always look for that feedback, and we always try to learn if we get it wrong. And we have been doing a lot of work at the moment to look at how we change how we regulate services, how we assess services, and what information we use to inform that. And alongside the stuff about the changes that we're making, that we've been talking about with Emily and John, is for the first time being absolutely clear that one of the default information channels that will inform our evidence on services will be information from people who use services. We've always gathered it, but it's where it's not been there, or where, for other reasons, it's not always been default part of the assessment. Whereas now it is what joint with other data, it's one of the pieces of information that we're going to be using.
Thank you very much, guys. I'm conscious of time, and we've only got about 12 minutes left, and I want to get to as many questions as possible. Anne W has asked in the chat, Colin, you mentioned the difference between between feedback and a complaint. How does the CQC feel about being copied into a complaint made to a service? Does this contribute to your aggregations, or is it pointless?
So how do we feel about it? Just being copied in can be helpful. We do, I talked in our slides about the feedback form on our website. The bit I didn't say is that you can also telephone us and email us. And actually, if you have hearing difficulties and don't want to use our web form, we do operate the Sign Live system on our telephone helpline system. Works with Sign Live as well if you didn't want to use our online form. So yes, you can if you're writing on paper or by email to a service, you can copy our system, their email addresses on our website on the contact us page. One of the reasons we like the people to use our Give Feedback on Care Online form, however, is that it does help us check we know what service you're talking about. So let's say when from any page on our website, you Frank, can you share the screen again, and from our website just click on the Give Feedback on Care link, please. It will ask you about service, because if for some care homes and GP services particularly, there are several of them in the country, and in big cities there may even be a care home on one side of the city of the same name as one on the other side of the city. So going through our form just helps us make sure we know what service you're talking about, and it helps make sure that we're asking you. You don't have to fill in all the questions, and you can do it anonymously, but it makes sure that we've got the click the Start Now button. I think it should take you to the service finder. Do good and bad. Where did it get to the service finder? Maybe it's on the next screen. I can't remember. Yeah. So that will just help make sure we're talking about the right care home. I know Willow Trees Care Home. I'm picking a name here quickly. There are quite possibly several of those in the country. I'm sitting here in South London. There are quite possibly more than one in London. Let's make sure we're talking about the right service that we're applying this to. And then the other questions we go through, let's say you don't have to fill them all in, and you can do it anonymously if you want. But it helps just make sure we're getting the different bits of information that we look for against our approach to assessing services. But if you'd want to email us and copy in, then do that. But it's the structured information for our web form just helps.
Thanks, Fran, for sharing that, and Colin. And I think it's worth pointing out that you do really appreciate hearing good feedback about services as well, don't you? As well, if someone's had a particularly positive experience, that's really helpful for CQC too.
It can help contextualize other stuff about service, especially it can help in any service, because they can have good bits and bad bits, but especially in some big hospitals, they can be particular problems in accident emergency, and the child ward, the pediatrics ward, or the heart disease wards might be incredible, and that just helps us know where to focus our attention. And indeed, it might help them getting out outstanding rating.
Perfect. I'm going to go to Catherine next, then I'm going to take Jenny's question from the chat, and then Paul, hopefully we'll have a chance to come to you as well, but again, conscious that we've only got 8 or so minutes left.
yes, this is something that I know there's been, people talking to MPs and government about whether this can be changed. CQC has the power and indeed the responsibility to look at places providing care. So just sheltered housing, we don't. But as you point out, there are sometimes fine lines in between where, where does the care start? Is the care being supplied by an outside domiciliary care agency rather than the housing provider? Yeah, it's there are fine lines in that situation that has made it put some people in the situation you're in. If they're providing care, we have the power and indeed the responsibility to assist them. If they're just providing housing, we don't. But as you know, that can get a bit tricky.
I hope that was a really helpful session. Thank you very much to Colin and Fran for coming and talking about the work of the CQC and talking you through some of the questions that you've had today. I really appreciate you all coming to this session.